Welcome back to another episode of The Radio Psychs, your premier podcast for insights into everything mental health. I'm Dr. Aaron Haddock.
And I'm Dr. Rhonda Yu. We're psychologists who care about people and bringing science to practice.
And we're so glad to have you join us.
Please note that the information shared in this episode is solely intended for informational and entertainment purposes only and is not a substitute for professional medical or mental health advice, diagnosis, or treatment.
Today's topic is approaches to psychotherapy.
You know, Aaron, the field of mental health can be confusing. There's so many different types of mental health professionals with different specialties and levels of training.
It's true. You've got clinical psychologists with doctoral degrees like us, psychiatrists, which are medical doctors specialized in mental health, and a whole range of master's degree level professionals like licensed clinical social workers, marriage and family therapists, licensed professional counselors, and more.
It can be difficult for the public to know which type of mental health professional is likely to be the best fit for their needs. It's like if you were having an issue with foot pain, and when you went to seek treatment, you discovered there were 15 different types of medical professionals specializing in treating feet.
What kind of foot pain?
I don't know. It's just a random example.
Like a bunion?
Sure, a bunion.
Or maybe gout? Or an ingrown toenail?
Dude, this is getting weird.
And it gets even more convoluted in the field of mental health, since mental health professionals can really differ in their theoretical orientation and approach.
That's true. All mental health professionals don't understand and treat human problems in the same way.
Yeah, different therapeutic schools can frame psychopathology and therapeutic work quite differently.
Of course, there are a number of different approaches to psychotherapy, but in this episode, we're going to explore 4 widely practiced, evidence-based approaches you're likely to encounter when looking for a therapist.
That's right. Think of it as a little insider knowledge to help you find the type of therapist that might be the best fit.
And this is actually quite important since research in psychotherapy consistently shows that the fit between therapist and client plays a pivotal role in the success of therapy.
It can be like finding the right key for a lock. When you click with your therapist, you're naturally more inclined to engage fully in the process. You'll find it easier to attend sessions regularly, openly discuss your challenges, and be more vulnerable, all of which influence the effectiveness of therapy.
Plus, the research also suggests that believing and expecting that your therapist will be able to help you greatly increases the likelihood that they actually will.
Okay, so psychotherapeutic approaches can be broadly categorized into a few different schools of thought, each with its unique focus and methods.
The first school takes us back to the roots of psychotherapy in psychoanalysis and the work of Freud and his colleagues. Psychoanalysts like Freud believe that our conscious mind is just the tip of the iceberg. Below the waterline lies a vast realm of subconscious thoughts, where our true desires, beliefs, and conflicts reside.
In this view, the words we speak often mask deeper, hidden meanings. So, for a psychoanalyst or psychodynamic therapist, the key isn't just in what clients are saying.
That's right. It's about interpreting the symbolic messages and conflicts that are lurking beneath the surface of their words.
So, a therapist from this school acts more like a detective?
Exactly. Like a blend of a detective and an archaeologist, helping clients uncover hidden thoughts and feelings. By analyzing dreams, free associations, and slips of the tongue, psychoanalysts aim to bring these unconscious elements to light. It's believed that this process helps clients confront and resolve deep emotional conflicts and gain insight into their inner selves.
Got it. Interesting. Let's contrast this with cognitive behavioral therapy, or CBT. Aaron Beck, who's often regarded as the father of CBT, initially developed this approach partly out of his dissatisfaction with the psychoanalytic approach.
That's right. It was a big shift, wasn't it?
Massive. So massive, it's often referred to as the cognitive revolution.
In CBT, the focus is on the here and now. And unlike psychoanalysis, it's a top-down approach based on the idea that our thoughts, emotions, and behaviors are all deeply interconnected.
That's really the foundation of cognitive CBT, isn't it?
It is. CBT operates on the principle that our thoughts can influence our feelings and behaviors, and by changing these thoughts, we can change how we feel and how we act. It's a very active, hands-on approach to therapy.
Exactly. Clients and therapists work together to identify and challenge unhelpful or distorted thoughts, like, I'm never going to be good enough. They then endeavor to replace these with more realistic and constructive thoughts.
And it's not just about positive thinking, though, right?
Correct. It's about realistic thinking. The goal is to help clients develop skills that they can use to cope with challenges in a more effective way. This involves a range of techniques like cognitive restructuring, behavioral experiments, and exposure therapy, to name a few.
CBT is typically more structured than other forms of therapy, and it's designed to be short term, focusing on helping clients deal with a specific problem.
Through the process, clients learn to identify distortions in their thinking, see problems in a different light, and find new ways of behaving.
And there's a lot of evidence to back it up, right?
Yes, there's substantial empirical support for the effectiveness of CBT in treating a wide range of disorders, from depression and anxiety to eating disorders and PTSD.
But CBT isn't the only approach that focuses on the present moment and our direct experience, is it?
No, it isn't. Acceptance and commitment therapy, or ACT, takes a slightly different approach. While CBT aims to change the content of our thoughts, ACT works by changing our relationship to our thoughts, particularly those we tend to avoid.
Right. ACT teaches that avoiding pain and distress can actually increase suffering. It advocates for accepting these feelings as a natural part of life. At its heart, ACT focuses on psychological flexibility, the ability to stay present and take actions aligned with personal values despite the discomfort.
This flexibility means being open and adaptable, facing life's challenges without avoidance.
Ultimately, ACT doesn't seek to remove discomfort, but changes our relationship with it, promoting a value-driven life in the face of challenges.
Then there's also mindfulness-based cognitive therapy, or MBCT. How does it fit into the picture?
MBCT is intriguing because it combines mindfulness with cognitive therapy. At first, these might seem contradictory. In CBT, you're actively wrestling with your thoughts, while mindfulness is about observing and accepting them. But MBCT suggests having both tools is crucial.
So, depending on the situation, you might actively challenge your thoughts or choose to step back and observe them without judgment.
Exactly. It's about flexibility and having a range of strategies at your disposal. Sometimes it's beneficial to dissect and challenge your thoughts. Other times, the best approach is to simply observe them, accept them, and let them pass without getting entangled.
It's a powerful reminder that there's no one-size-fits-all solution. Understanding and incorporating elements from all of these approaches can give us a versatile toolkit for managing our mental health.
As you can see, the approaches covered are different. Each one is unique and may address different needs and preferences.
Wait, I bet it was plantar fasciitis.
Of course it was. Moving on.
If you're in the process of seeking therapy, we recommend you consult with a qualified mental health professional to determine the most appropriate therapy based on your individual needs and circumstances.
Absolutely. Thanks for joining us on this expedition across the psychotherapeutic landscape.
We hope it provided a useful guide for your mental health journey. Take care and be well, everybody.
Take care. Be well.